All right, Dr. Emer, you're live.
Hey guys, it's Dr. Emer. We're doing Morpheus treatment. And this is one of my favorite tightening procedures for the tissue itself. We already did a lifting with InstaLift that's in the skin. You can see the little dimples there. This degree of bleeding that he has is great because this says that we're going to that reticular dermis. We're getting a nice amount of tightening in there, which we're going to get a lot of long-term collagen production. Morpheus is deep microneedling radiofrequency. You guys can see here.
Wait, can you show us again?
Yeah, take a look. These are gold-plated needles. They propel into the skin. And I'll tell you, I've yet to find a person that has done this treatment that doesn't love it. We've probably done over 10,000 treatment areas on the body, on the face, on the vagina. We've done it everywhere to get tightening. This is going to improve the texture subtly, but not nearly as much as doing lasers, which is why we're going to follow this with Halo. So stay tuned for that. We'll play some Halo in the background at the same time, just to get the mood to go in. I do want to get her in here though one day.
Yes.
Beyonce and doing Halo at the same time. Oh, it's my dream. Beyonce coming in for Halo. But now we're doing the Morpheus, and we're literally stamping deep 3 to 4 millimeters. You can go 2, 3, 4 millimeters in depth, but the energy spreads even beyond that. You get coagulation of the tissue underneath the skin, so areas like the under eyes also tighten and become really good. And so around the eyes, we go a little lighter in depth.
Can anybody do this treatment?
Yeah, this is for any skin type. These are gold-plated, what are called coated needles. And coated needles are safe in almost every skin type. It's rare to get hyperpigmentation, but if you're a super dark skin tone, my suggestion would be you pre-treat your skin no matter what with our Cosmetics.com pre-treatment kit. He's a lighter skin tone and he just gets sun damage. He's light toned. So he does regular skincare, anti-aging, and retinol and lightening creams prior to the treatment, and then afterwards going to be more aggressive with what we do for him because we're going to do Halo treatment. So depending on what he lets me do, which I think he has a whole week, might as well go strong on him just to get the improvement. The other thing I want to talk to you guys about is early on treating your neck. It's really important. Jawline and neck, we treat it even in women, chest, because women tend to show off their boobies and their chests a little bit more than men showing off their boobies. So they get a little more sun damage. So we have to treat that with peels and lasers earlier on so you don't have that dark pigmentation issues and redness on the chest area as you age. We call that poikiloderma, which doesn't look pretty, chicken skin. Okay? So we're tightening, we're working on that neck area. Jawline. How does it feel?
I hardly feel it.
I barely feel it. Because he was topically numbed and we did nerve blocks. Now we could use Pronox, we could do pills. There's a lot of things you guys can do.
What is Pronox?
Pronox is oxygen nitrous gas mixed together in a tube. It helps you feel relaxed. It helps your mind forget about pain as it's occurring. And so a lot of my patients will ask for it. Strong combinations.
Real Mike 15 is asking if this is an acne treatment.
Well, interestingly, Morpheus has not been studied for acne. However, Fractora, which is Morpheus' sister, has been, or brother, I don't know if it's male or female, but we have to determine is Fractora male or female name. But it has been studied recently for acne, especially in darker skin types, and showed a significant improvement. That's why if you follow my YouTube channel, you guys will see that part of my Accutane protocol is what? What's up? Fractora and Halo and during Accutane. When they have acne, laser genesis. Remember, deep heating of the skin. Airleads and laser genesis with Fractora is amazing for those that have Accutane. But for him, we're trying to do resurfacing and tightening, which is why we're using Morpheus. So we're going to do laser Being very meticulous on the areas that we're treating. And remember, you're not going to see a lot on the surface. This is going where? Deep into the tissue. Alright? So now we're going to go on to the neck. Remember I told you, you don't want to forget the neck. Never forget.
Should everyone treat their neck?
Everyone, I don't care what age, treat your neck. Be preventative. It's like eating healthy now, so your arteries don't get clogged. Morpheus is your artery clogging prevention treatment of the neck. Okay?
What
So
is
get
the
rid of
difference?
sun damage and tighten the skin.
What is the difference between Fractora and Morpheus?
We just talked about that, but I'll say it again. Morpheus is deeper for tightening, Fractora is more superficial for texture, which is why it's used for acne and acne scars, fine lines, and wrinkles, whereas Morpheus is tightening, contouring, tightening the jaw, tightening the neck, tightening the skin, prevention of sagging. You want to prevent sagging, you do Morpheus. You want to improve your texture, you do Fractora and lasers. Now, can you do both, the tight and bright? What is tight and bright, you guys? It's lasers with Morpheus. Going to double pass over the contouring areas of his jaw. Okay, turn all the way left now.
If you guys want to know what treatments would be best for you, just email us at appointments@jasonemermd.com and visit our website.
Yeah, you guys, we really have to customize these things. I can't tell you prices or, I mean, we combine so many things because we want the best outcomes. Remember, this is where we just put in some of those threads, so we're going over those areas so that the deep part is with the threads and the superficial part has Morpheus.
This is not painful, but Dr. Emer, what needle depth are you using?
Well, this is the base depth, which is 3 millimeters. For tightening. You guys know that. You guys, the doctor, anyone that's asking that's a doctor, they know it. Because it's the treatment. It's the protocol. You guys. Now doing a double pass, doing it with laser, doing it with threads may not be the protocol that you were taught, which is why I went to 2 fellowships and did 16 years of school.
He's currently doing a double pass right now.
Yeah, double pass of Morpheus. Base and neck. Sometimes it's good to do a little pinch, get those thinner skin areas, so you get all the way down there. The other thing is that to go all the way back, remember this is tightening, we want to lift the tissue. It's got all the sun damage, it's got all the tightening. No, you can't. Okay, turn around this way, let's go.
And Dr. Emer, what's the downtime?
The downtime depends on what we're doing. If we're doing just the Morpheus, it could be a day or two, just the light redness. With him, with the halo, with the threads, let's make it a week. Let's make it 5 to 7 days. Let's do a lot of improvement. So we're going to go a little stronger on this halo, so we can get rid of a lot of the sun damage. And so we'll probably do it 5 to 7 days. So take some pictures for us, give him a selfie light, send some videos in. It'll be perfect, and you all can feel much better knowing he's okay. And they always ask. They ask people out, and they ask them to see their videos on my Instagram. It's hilarious.
This patient is awake. He has numbing cream and nerve blocks.
And I'm
And
in a sensitive area. He's doing really good. And then again, I'm going to do an additional pass on the jawline area here. Bring your head straight for me. Beautiful. One of my patients tagged us last night. She had this done a few days ago with pre-treatment of an enlightened peel. So I'm going to post that today. Once we promote the live, we'll post that as well. So you guys can see how she looks.
a lot of people are asking if he's out,
Who?
if the patient is out or asleep.
He's awake. He's smiling, see? Usually you don't smile when you're asleep unless you have like a really good dream. You could have amazing dreams.
Maybe dreaming of Beyonce getting halo.
Beyonce getting a halo. That's me smiling. 100% me smiling. If anyone knows Beyonce, please send her in. I would love her to actually sing Halo while she's getting Halo. I would go berserk. Alright, so that was perfect. That was our Morpheus. We're going to numb him now for about 10-15 minutes, and then we're going to do Halo. Stay tuned.
Stay tuned for Halo, guys.